We are live on channel 16 and live on Facebook Live for our coronavirus Q&A. Today is May 6, 2021. We have been holding these for the last year since the pandemic started, which really the pandemic started on March 15th for us here locally. We declared a local state of emergency, and since then, this city has been working hard, all of us, to keep our community safe and to save lives. And over a year later, I am really proud of the work that everyone here in Evanston has done to keep this community safe on all comparative metrics, whether it's infection rates, whether it's vaccination rates, whether it's cases per 100,000 or deaths per 100,000. Evanston is comparatively are doing much better than many of our neighbors, being the city of Chicago or Skokie or even the state of Illinois. So there's a lot to be proud of in a really difficult time over the last year. I am pleased today to have our public health director with us, Ike Ogbo, to have our deputy public health director, Greg Olson, with us, and to have two of our volunteers who are really superstar volunteers throughout this entire effort here with us today. So we can talk about the volunteer effort that so many citizens stepped up, whether it was with the Medical Reserve Corps or the CERT program. And so we have Dr. Peter Gann with us, and we'll be hearing from him shortly. And we have Dr. Elizabeth Hicks with us, who's a member of the CERT team. So welcome, everyone. Before we get into the questions, and I know there's lots of questions, and remember, if you have a question as this is going on and you're on Facebook Live, you can put that question into the comment section, and one of our city staff, Patrick Degnan, who works behind the scenes and helps us put on all these coronavirus Q&As, he will monitor that and feed me those questions. So we'll get those questions answered as well. Before we get to the questions, I would like to share with everyone the really good news on where we stand with vaccination rates here in Evanston. So I'm going to ask Patrick if he will put up the data. We have 3 slides that I wanted to walk people through. As I said up front, this hasn't been an easy time over the last year. I know there's been a lot of uncertainty, a lot of anxiety that folks have had, and yet through all of that, whether it was about concerns about getting the virus or getting vaccinated at a time when there weren't enough vaccines, and I was frustrated and everybody was frustrated why we didn't have more, I am super proud to report that on, again, a comparative basis, Evanstonians have proven to be very resourceful people in getting vaccinated. We have had Evanstonians vaccinated in close to 1,000 locations, which means they couldn't have all been vaccinated here in Evanston. They weren't even all vaccinated here in the state of Illinois, but all over the country. And I am proud today to report that in Evanston, 100% of those eligible, age 65 and up for the vaccine, have been vaccinated. Now and they have received at least 1 dose. So 100%, as you're seeing here in that blue line to the left. And you're probably saying, well, okay, Mayor, like how can we have more than 100%? So that everybody's clear, the denominator here is the census count on how many 65-year-olds we have in Evanston. Realize that that's an estimate, and that we're also vaccinating people that work in Evanston. So you could be over the age of 65, work here, and could have been vaccinated here too. So that could factor into to why we're seeing a percentage that's actually over 100%, even though we're showing 100% right here. And that's the rationale for it. 92% of those 65 and older have received 2 vaccines. That is really good news. Remember, when we had limited supply of vaccines, we did make a decision here in Evanston that we were going to allocate those vaccines to those that were most at risk. And we know throughout this entire pandemic that those are folks 65 and older. So that was a decision made by Ike Ogbo and our public health department, one that I agreed with and I think many people agreed with. And we're seeing the benefit of that on this chart. If you compare where Evanston stands, you can see, Chicago's down at 72 and 62%, again, for first doses and then for both doses. Cook County is doing well at 75% and 68%, and then Illinois, and then you've got the national average. So on every metric, folks here in Evanston have really stood up and taken things into their own hand and finding a way to get vaccinated. So I really appreciate that effort and the effort that our public health department made. If we look at vaccinations by region, and this is for the entire eligible population. Remember, right now the eligible population is those 16 and older. We'll talk a little later about when we may start to see a vaccine for those younger than 16, which I know many people, including myself, who has a child in the house who's 13 years old, are anxious to have a safe vaccination for them as well. But if you look at the overall eligible population, 78% of Evanstonians have received at least one dose, and almost 55% have received 2 doses of the vaccine. Again, you compare that to Chicago, Cook County, Illinois, the United States, which all are generally at that same level. Evanston is running, 15, 20 points higher than the country. And so again, really, really good news. I think it also speaks to the fact that, Evanstonians, for the most part, see this as a safe vaccine, which I very much believe it is. Our medical community here in Evanston strongly believes in this vaccine. And so we have a high percentage of our population that are getting vaccinated. That is good for all of us. It keeps our community safe, but we do need, because people cross borders, we do need everybody in surrounding areas and throughout our entire state and really throughout the entire country to get vaccinated. So we'll talk about that now because we're moving into a stage that's a little harder, right? Where some people are hesitant and we need to get out there, all of us, with an appropriate message that helps reduce that hesitancy and gets folks vaccinated. And then the last chart I wanted to show was new cases per 100,000. So I talked about the infection rate and that Evanston's done a particularly good job from the very beginning of managing and containing our infection rate. And if you look on this chart, the blue line is Evanston throughout really the entire disaster. You're seeing a year here, and very seldom did that blue line cross, the yellow or the red or the green, which represents Skokie and Chicago in Illinois, which means we consistently throughout this event managed really well the new cases per 100,000. And so if you look at the very end right now of where we are today, Evanston continues to do a really good job. So kudos to everyone for the job that you've done. Despite all of this good work, I don't want anyone to forget. We should always be mindful that sadly we have lost 116 lives here in Evanston due to the pandemic. And if you drive by the Evanston Civic Center, you'll see flags out in front of the Civic Center, which is a touching memorial for each person that has passed away, sadly, because of this event. So that's the news and where we are. Let's get down to some questions, and I'm going to start with our public health department. So Ike and Greg, let's start here, Ike. Are new COVID-19 cases occurring among those who have not yet been vaccinated, or are individuals who have been vaccinated still contracting COVID-19? It's a good question.
Good day, everyone. We're not seeing what we categorize in public health as breakthrough cases in Evanston. We don't have any reports of any breakthrough cases in Evanston, which is great news. So we're keeping tabs on that. People who've been vaccinated and possibly be able to get COVID-19, but it's not something that we have been experiencing here in Evanston. As I mentioned, this is great news that we're not seeing that. About 2 weeks ago, I was in communication with director for Chicago Health Department. At that time, she also expressed to me that they are not seeing any breakthrough cases in Chicago either, which is absolutely great news. And I hope that this trend continues where we're not seeing any breakthrough cases. Is it possible? Yeah, it is possible. There are some reports of breakthrough cases where people have been vaccinated and contracted the virus, but it's not something that we have been experiencing here.
But the bottom line then, as I listen to you, is that the vaccine is highly effective
Absolutely.
from, protecting people from getting COVID-19.
Yes.
And
Definitely.
those that are getting COVID-19, that have, the few cases out there that where they have been vaccinated and still gotten COVID-19, the condition has been much less severe for them.
Absolutely. And that's what the vaccine does. The vaccine, what it does is prevent you from seriously getting ill from COVID-19, but it doesn't necessarily mean that you can't contract or transmit the virus. But these are effective viruses at high efficacy rates to make sure that people are protected from COVID-19.
So, one of the items in the news recently was that there are a lot of people around the country that have gone for their first dose and received their first dose, but they never came back for their second dose. Are we seeing that here in Evanston?
It's not a significant issue here in Evanston. People are receiving their second doses in Evanston. What we've actually experienced, the mayor, is people who will miss their second dose and want to schedule to receive their second dose for another day, maybe due to a business matter or due to travel. But we've been able to accommodate those individuals. And as you mentioned a while ago, vaccination is kind of like, okay, a bus ticket. If you miss today's vaccination event, we have vaccination events subsequently every week where people can get their second dose if they missed it when they were pretty much due. And also you have to keep in mind that after the first dose, you have up to six weeks to receive it. But that's not what we are recommending. We're recommending that people get their second dose close to 3 weeks for Pfizer, or 4 weeks for Moderna vaccine.
Great. So bottom line, we are not seeing that in Evanston. People in Evanston that are getting vaccinated understand that if you got the first dose, you got to come back for the second dose, and you're not fully inoculated and protected until you've gotten that second dose, and it's been generally, I believe, like it's a 2-week period after your second dose where you then are fully inoculated.
Yeah, absolutely. It is after those 14 days where you're adequately inoculated. And that's why we are strongly encouraging people to get the full series of the vaccine: Pfizer 2 doses, Moderna 2 doses, Johnson & Johnson a single dose.
Okay. All right. Great. Thank you. Hey, Greg, let's go to you with this next question. I mentioned up front, I think we're moving into a more difficult stage right now where pretty much everybody around here that has really been anxious and wanted to get vaccinated has been able to get vaccinated. And I'd like you to talk just a little about that as we're doing vaccination events, what ages we're down to, Greg, because, for the longest time we'd have these coronavirus Q&As and it'd be like, yeah, we're at 70 and above or 72 and above. And I would get all these emails like, Mayor, come on, let's get going. And we didn't have enough vaccines that were going to our health department, which everybody was frustrated about, including me. So I'd like you to talk a little about where we stand right now with our events. But I want you to talk about this new stage, I think, that we're moving into, which is how do we vaccinate those who have some hesitation right now to be vaccinated, and what efforts we're trying to take there.
Yeah, so vaccine hesitancy, I mean, there's going to be hesitancy for every single vaccine. There's a spectrum of people who want the vaccine actively and they will go out of their way to get it. There's individuals who will get the vaccine if it comes to them, but they're not going to actively seek it out. And then there's others who, are actively not getting the vaccine. The good thing that we've seen with this vaccine, and it shows in our percentage vaccinated, is that a lot of Evanstonians wanted this vaccine, which is great. So we at our pods, we're down now to 18 and up. Everybody in the Evanston community who lives or works here is eligible for a vaccine at our pod. Since we're doing the Moderna vaccine at our pods, you have to be 18 years of age or older. And so in the beginning, we had the model of mass vaccination sites in order to get as many people as we can. Now that it's getting harder and harder to fill those open first dose spots just because everyone's gotten it, we're having to switch our models to make the vaccine as accessible as possible. And we do this by holding community events out in the community. We've done 3 church events. We have an event coming up this weekend on a Saturday because, we know that our vaccine clinics take place during work hours during the week and people can't take off work. So we're having a weekend event this Saturday so every individual can do it. So really it's making the vaccine as easily as accessible as possible. Another way we've been doing it is in-home vaccinations as well. For individuals who can't make it to our events, we'll bring the vaccine and go into their house to do it. So it's boots on the ground basically at this point to get it to everybody who wants it.
And you're doing a heck of a job. Again, 78% of the eligible people have had at least one dose here in Evanston. So what about the folks? We got a question in from a guy named Steve who wants to know, I have a 17-year-old who hasn't been vaccinated yet. And you just said at the city event, you have Moderna, which is 18 and older. Well, what about my 17-year-old daughter? How does she get vaccinated here in Evanston?
Yeah, so Pfizer vaccine, that's currently the only vaccine that is for 16 and 17-year-olds, 16, 17 up. So we have been partnering with Amita St. Francis to administer the Pfizer doses. Actually, just this week, Amita is holding a event prioritizing 16 and 17-year-olds in the Evanston community. So we've been stressing to have everyone fill out that vaccine contact form. And now at this point, even younger than 16, since, it's assumed at the end of the month, Pfizer will be granted the EUA for 12 to 15-year-olds. So parents should be filling out contact forms for their children if they would like them to get that vaccine. Because that is how, that's one of the ways that we'll be able to reach out to you if you're of that age group to notify you of the vaccine with Pfizer when it becomes available.
Thank you, Greg. So can you elaborate on that? Because we have this contact form, and I think it's important to remind people. I mean, Greg touched on, the FDA possibly approving soon in the next week or so the Pfizer vaccine for those, I believe it's 12 and up. So can you talk to the community about that a little more and what they need to do if they haven't already and they're interested in getting their, 13-year-old son, or daughter vaccinated?
Absolutely. We are being hopeful that by the end of this month, early June, that Pfizer will be approved for 12 and up. So we want to ensure that everyone who wants to get vaccinated here in Evanston gets vaccinated. And one of the avenues that we are employing is that vaccination contact form that we have online. If you have not completed that form, I'm using this as a public service announcement. Please complete that form. It is not restricted by age. You can enter any age in that vaccine contact form because we know, hopefully, that by the end of this year, that there'll be some approvals for perhaps Moderna, because right now they're in a trial phases for those who are 6 months and older. So that contact form will be our deposit of names and individuals who are interested in receiving the vaccine. So that's pretty much our avenue of reaching out to individuals when vaccines are available for particular age groups to get vaccinated. So that's what we are encouraging people to do at this moment.
All right. So if you're watching this and you have a child and you haven't filled out the contact form, you should go to the City of Evanston website.org/COVID-19 and look for this contact form, or just Google City, Evanston COVID-19 contact form, and it should come up, and you want to complete that contact form as soon as possible. That way the city is aware. Now, do we envision that for those under 16 that we will have point of distribution events as you've had for others, or that the vaccine for those under 16 will really be administered through the existing healthcare infrastructure that we have?
At this point, we're exploring as many options as possible. They can go through healthcare providers if by that time the healthcare providers are able to order their supplies directly from the state. We will also explore the idea of using a centralized location, just like we have been doing throughout the pandemic. Right now, we get the Blomquist building at Northwestern. We're also looking at other options of going to where these age groups are, whether it's a particular location, whether it's the schools, to get them vaccinated. So there are a number of options that we are exploring at this time, which will be effective options to get that age group vaccinated when the time comes.
Have you coordinated with our District 65 and District 202, particularly high school students, because you could have some that are age 16 and above, Ike, in getting them vaccinated? I know we've made a big effort here and through our partnership with Walgreens and Walgreens Health Solutions, a local company helping us, get teachers vaccinated here. But are our high school students also getting vaccinated, and are you coordinating with the high school on that?
Yeah, absolutely. I actually have a meeting right after this one in the mayor to discuss those plans and options. So we have been communicating with regards to 12-year-olds and up, 16-year-olds, 17-year-olds, to get them substantially, especially with 16 to 17-year-olds, to get them substantially vaccinated, and discuss plans on how to get 12 to 15-year-olds vaccinated when the Pfizer vaccine is approved, optimistically by the end of this month, but early June.
Thank you, Ike. I want to turn our attention to, for just a minute, to who's getting infected right now. All right, we have vaccinated, our senior population. We've vaccinated lots of our middle-aged population, and now, as Ike just mentioned, we're vaccinating our younger people. Yet we still are seeing cases out there. We talked earlier that this vaccine is effective. If you get the vaccine, your chance of getting COVID is really pretty minimal. Yet we're still seeing cases. So, Greg, why don't you take this one and talk to us about who is getting infected right now? What are the patterns that we're seeing? And who's being hospitalized?
Yeah, so right now the majority of our cases are in the 20-year-old to 30-year-old age group. That's where we've been seeing them for the last few weeks. And that's specific to Evanston, and that actually translates to how it is across the state as well. So it's around 65 to 70% of all of our cases are in that age group. So that's why we're trying to target the younger groups to make sure that they come to our vaccine events. I know that's a lot of the college age individuals, and the state of Illinois recently had a college days vaccine event. So a lot of college universities we're able to take advantage of these state-sponsored vaccination sites. And, you know, we're seeing it too, because we've been having weekly meetings with Northwestern, along with other county health departments, and everybody's having a difficult time filling those first dose spots because people are getting vaccinated. And we just want to continue to spread that message to the younger population who is seeing those spike in cases.
Yeah, I think it's really, really important that we stress that. When I sit in on the emergency operation, I'm part of the Unified Command and the Emergency Operations Center. When we have our meetings, or even the mayor's pandemic task force meetings that we have been having weekly, with many different leaders in the community in different sectors, including the hospital presidents. It hurts when you listen to the hospital presidents and they talk about, oh yeah, we've still got, 60 people hospitalized with COVID-19. And now they're not necessarily, people that are 70 or 80 years old. They're people that are 30 or 40 years old that are having a really bad case of COVID-19 and being hospitalized. Now, I think we're seeing the deaths, fatalities from that go down, meaning, their likelihood of having a fatal case of it is decreasing, but they're still being hospitalized. And I think that's really important for us all to remember. We are not, done with this pandemic yet, even though we can all see the light here and we're all excited about summer and being outdoors. I think it's really, really important to stress that we need to continue to wear masks when we are indoors, certainly. And if we're outdoors in a larger gathering, we need to wear masks. So I want to turn to you on this, because CDC has recently put out some updates on social distancing and mask wearing. Can you share that with our community? And then I have one more question, and we're going to pivot to our volunteers who have made this all happen.
Absolutely. We're continuing to strongly encourage individuals to wear masks when 6 feet distance is impractical to meet. We're encouraging individuals to avoid large crowds. We are encouraging people to wash hands, use sanitizer, stay home when you're sick or if you exhibit symptoms of COVID-19. Vaccinations alone wouldn't subdue or control substantially this virus. We have to continue applying these basic preventative measures that we have been applying since the beginning of this pandemic. So as we go into this pandemic, these are tools that we must use to protect ourselves and to protect our community.
Okay. All right. Last question for you. How many, for adding first and second dose vaccinations, just in terms of quantity, how many have we done through the public health department? Yes. An estimate. It doesn't have to be the exact numbers. 20,000, 30,000?
At this point, approximately 19,000.
All right. So almost 20,000, needles have gone into the arms of people. And could you have done that without the large group of volunteers?
No, and I can't thank them enough. They have been tremendous in our efforts. And not just with vaccinations, Mayor. They have been instrumental in contact tracing, case interviews, and of course, vaccinations. And another point, this has not been the only large-scale event in which they have participated in multitudes, I would say. If you remember in 2009, 2010, we had the H1N1 outbreak, and they were instrumental in ensuring that over 12,000 community members were vaccinated. So they've been tremendous, and I can't thank them enough. They have come to our aid, and we appreciate their efforts. We're appreciative of that. We're appreciative of their input and everything that they've offered throughout this pandemic.
that is a great segue to our two guests today, Dr. Elizabeth Hicks and Dr. Peter Gann, who, along with many, many other people, have volunteered their time and their expertise and their training to help our community through this pandemic. I have said before on the coronavirus Q&A and many other places that I've been, that there's nothing better, in my opinion, than helping people at a time when people really need the help of the government. And I've been blessed to spend an entire career doing that after all sorts of big incidents around the country. I never thought I would spend my time as mayor, spending over a year doing that, but it's incredibly rewarding and fulfilling work. And I think both Dr. Hicks and Dr. Gann would agree. And so I want to share with everybody that's watching what these two programs are and the type of work that our volunteers have done. So let's, Dr. Hicks, let's start with you. And first, why don't you just provide a little background to folks that are watching on your background, and then describe how you got involved in the CERT program and what CERT means. I'll let you share that with everyone, and how you got involved. And folks that are watching, keep this in mind. If you have an interest in the future in volunteering and being part of an established program, CERT and MERS are potential programs that make a big difference. So, Dr. Hicks, welcome.
Hey, thank you. So I'm Elizabeth Hicks. I'm a research scientist, and I study fluid dynamics, specifically for astrophysics. So I'm also a part of the CERT team as a volunteer. I'm also part of the MRC, actually, but I'm here today to represent the CERT team. So the CERT team is the City of Evanston's Community Emergency Response Team. So CERT is an idea that goes back to the early 1990s. And what happened is that the Los Angeles Fire Department in the 80s, actually, they had an earthquake, and they realized two important things. So first of all, in a really large disaster, the number of first responders is, you're never going to have enough first responders. It's just not really possible. And then the second thing that they realized was that people who were bystanders were going to try to help. They were going to try to do things to help people who were in need and who needed help. And so what this City of Los Angeles realized is that they could take advantage of that, and they could provide some training to people who lived in the city, and that training could help them be more personally prepared themselves. But it could also help them help in the event of a disaster, their neighbors more safely and more effectively. And that's where the CERT program was born from. And so it became a national program under FEMA. And so what happens is that FEMA sort of sets up a curriculum for the CERT program and has some guidelines for how CERT should be run. But then CERT is run by local emergency response agencies. So in Evanston, that's the Evanston Fire Department. So our Evanston CERT was established in 2004 by the Evanston Fire Department. And our current fire department lead is Division Chief Kimberly Cole. And so she's in charge of our group, and we offer sort of two things to help people in Evanston be more prepared, and also to help out potentially with disasters. So the first thing is that we have a CERT class. So the CERT class is open to anybody. It's a 6-week class, and we're probably going to have it this fall. And so it's one night a week for 6 weeks. And you get to learn how to do some fun things. So you get to learn how to, put out a small fire, do some light search and rescue, and you learn some things about disaster medical and disaster psychology also as well. And so it's a lot of fun. You get to have, go to class and have fun trying out all these things with your new friends. And so it's just a really good time. And then after that, some basic skills that are actually really useful, like actually using a fire extinguisher. Very fun. And so then afterward, you have the option to join the CERT team. And so the CERT team, we do continuing training to sort of keep those skills fresh. And then we also help out around the city just with regular events, like you may have seen us at, for example, Bike the Ridge or the 4th of July parade. We volunteer at both of those things. And then this year, you've also seen some of us help out at the coronavirus pods as well. And then also we're available for other kind of things like the Nichols school bombing was CERT volunteers who helped out at that. When the United Nations came to Chicago, the CERT helped out with that as well. So there's been a lot of different things over the years that CERT has helped out with. So if you'd like to find out more about the CERT program, you can go to cityofelvanston.org/CERT, and you can apply and get more information. So.
Thank you, Elizabeth. How many, do you know how many members of CERT we have here in Evanston?
So we've had hundreds of people take the CERT class. Current active CERT members is about 20. And we are, I think because of the pandemic, we've had a lot of interest. And so we're hoping to make the team bigger, like quickly. So
yeah. And I'll tell you, for the 4th of July, because CERT does help out with the 4th of July parade and all of that, but then they also get great seats for the fireworks down by the lakes. I hang out with all the CERT people down there when they got special viewing, and a little too close to the fireworks for me, but they're all certified, I guess, as these community emergency, helpers. So Elizabeth, talk a little more for our audience, if you would, about your role and the role of all the different CERT members with the pandemic, and how they used you for that.
Yes. So in the pandemic, there's been one major role and then sort of like two minor roles. So CERT is always kind of waiting in the background for someone to be like, we need you. So the first time that we got contacted was in December, when the health department was looking for extra contact tracers. So we put together a group of people, about 10 people, who'd be willing to do that. Fortunately, we weren't needed. So there wasn't this sort of after Christmas spike that was sort of feared. Well, it didn't get as big as feared. So the next thing that happened is that we were asked to volunteer at the coronavirus pods, and that's been most of what we've been doing. So we have about 10 people who are very regular volunteers, some extremely regular. I think we have one Marilyn goes to almost every single one. So she's really dedicated a lot of time to this. So we go, and then when you're at the pod, you get to do a lot of CERTs act as floaters. So they help to sort of show people where they should go at the pods. And then my personal job that I work on is a check-in screener. So when someone comes in, I check their driver's license. I make sure that they're in the system. And then I go through health questions with them. I think the most important thing I do is that I sort of give people information about their second dose and answer any questions that they might have about the virus, not about the vaccine. So sometimes people have, a concern about taking the vaccine, or, sometimes they're just really scared of needles. I get that. I'm really scared of needles too. So we can talk about being scared of needles together, and then I show them where to go. So it's
we had a question from Carol. Then I'm curious if you might know the answer. I'll ask you instead of and if you don't, we'll throw it over to Greg or Ike. Does the state of Illinois keep records on who has been vaccinated, and if so, how can I be sure that my record is up to date? A woman named Carol asked that.
Okay.
Question.
Yeah, I'm not going to have the answer is yes, they do keep records. How to check those records, I have no idea. So the health department's going to have to answer that one. Yeah.
We'll go back at the end to Ike on that one for Carol. All right, I've got another question, and it's going to be the same question for Peter, but I'm going to do it towards the end. Okay, so thank you for that, Dr. Hicks. Let's go to Dr. Gans to talk about MERS and what MERS means, and a little about your background, Peter, and how you got involved, and then what you're all doing out there at what you've been doing for the life of this pandemic, which is quite a lot.
Okay, so currently I'm a professor at UIC College of Medicine, and I'm in the Department of Pathology, but I'm not actually a pathologist. I'm an epidemiologist. After medical school, I got a second doctoral degree in cancer epidemiology. Which is very different from infectious disease epidemiology. Of course, we had to have some of that, but it's been really interesting for me to really increase my understanding of infectious disease dynamics as a result of this horrible problem we've had. I can't really give you a history of the MRC as Elizabeth just did for CERT, because I don't really have that knowledge, but I can tell you that in the really dark days, very early, last spring, when we were seeing hospitals overwhelmed and some just, unbelievable scenes of pain and distress, it really wasn't very hard to sort of think about how I might be able to help. And I think I feel, and I think everybody should realize how fortunate we are to have the kind of services that we have here in Evanston. First of all, I mean, having a certified health department with qualified people running it it makes a huge difference. If you can imagine what it would be like for us dealing with this pandemic if we were trying to do it through Cook County, for example, we wouldn't have the flexibility, we wouldn't have the access, and you certainly wouldn't be able to generate the kind of participation from volunteers. So the city, by partnering with volunteers and tapping into the motivation and the expertise of volunteers, is critical, not only for the pandemic, but I think for a lot of other things as well. So I found out about MRC probably at some point last year and signed up for it. But there wasn't really a lot that could be done at that point. We didn't have a vaccine, contact tracing. I wish there had been more contact tracing because, frankly, the way this virus was handled, we basically blew an opportunity to essentially eliminate it. By letting it spread and develop as many variants as it has.
Can I just stop you there, Doctor? Sure. I totally agree with you, and I just want for people that are watching, I think there's a lot of reasons why, again, on those metrics that I went over and I've gone over in the past, that we have done so well. There's a bunch of different reasons. One being we have a public health department. Another one being that, at least here in Evanston, we did do contact tracing from day one throughout the entire event. So when I just want the viewers who are watching, when you're listening to this, that didn't happen in a lot of other places, big cities and stuff, because it just became overwhelming to them. Yeah. And they sort of threw up their hands and they stopped contact tracing. And when you stop contact tracing, you don't know where the spread's occurring in your community.
No. What I was referring to when I said that we blew it, I meant we as a human race.
Yes.
not locally.
I just want to clarify that before I get a couple emails. I get lots of emails and people say, I knew you were confident, Haggerty.
No. The virus was far too widespread to allow practical contact tracing. I think we all understand that. I worked for several years in the New Jersey State Department of Health. Again, it was not an infectious disease, but I worked very closely with the people who were doing statewide infectious disease control. And essentially, for a lot of diseases, we are now able to, basically find the hotspots and surround them with contact tracing and vaccination and testing. And we simply weren't prepared to do that. And I'm talking about not only nationally, but certainly we're seeing that globally. So I want to also say that, just what was the experience like? I'm a physician. I used to practice medicine. I no longer actively practice, but basically when something like this comes up, you just want to do whatever is going to be helpful. And in this case, as Elizabeth was saying, in order to make these dispensing, I'll call them clinics, really function, you need people doing things that are frankly quite repetitive and very basic. They don't require a huge amount of skill, but they're essential. And so, and I have to say, having seen, I got my own immunization at UIC at the hospital there, and having talked to a lot of other people who've gotten their vaccine at other places, the process that was used by the city health department to conduct these vaccinations was far more organized, efficient than many others I've seen. The collection of data was extremely important, obviously. So one of the functions that, as Elizabeth described, people will come in and then they will have information collected about them that's essential regarding the safety of the vaccine for them, then being able to submit data to IDPH, the state health department, so that we can actually keep track of what's happening to the community. All of those things are functions that the volunteers were necessary for. I have to say also that as a volunteer doing these kinds of things, recording information on tablets, helping people coming in with questions they may have, it was really kind of a joyful experience, frankly, and I think it was positive in many ways. A lot of the positivity of it comes from the interaction that you have with people who are getting vaccinated, because particularly for their first shot, right? The sense of relief and the helping them overcome fears. A lot of people are obviously very afraid initially. It's just a very gratifying experience. The other part of it that actually is really gratifying is the interaction with the staff, and so I want to shout out Enes Qureshi, Greg, Ike, Parker, Christine. These people were phenomenal to work with, still are, and also the firefighter paramedics. They were a stitch, actually. I had a lot of fun working with them. And their way of kind of doing things. It was just a very, very positive experience. So I feel like we should all be proud, but also it's not over. The analogy I like to think of with COVID-19 is a forest fire analogy, where I think we've put out a lot of the main blaze, but I think if you've been reading recently, it's now pretty much consensus in the scientific community that we're going to be living with this virus for a long time. And there are going to be embers that are going to flare up for quite a while. So we're going to have to kind of keep the pressure on if we really want to control the virus.
Thank you, Dr. Gann, and thank you for volunteering. Ike, why don't we go back to you to talk just a little about MRC? And again, if you've heard the acronym, you're like, okay, you never really said what MRC is. MRC is the Medical Reserve Corps. And so, Ike, when did we start to adopt the MRC, and how many folks do we have on it? And what other roles besides the role Dr. Gann played did folks play in that?
Thank you for that question there. As far as I've been with the Health and Human Services Department, we've had MRCs, and I've been with the Health and Human Services Department for almost 13 years. Pre-pandemic, we had in the tune of 40 MRCs, but I am happy to announce that in the course of the pandemic, we now have over 90 MRCs who are volunteering their time, who have helped, as I mentioned earlier, with contact tracing, case interviews, and with our vaccination efforts. And they've just been tremendous, Mayor. They have been wonderful in helping us navigate this pandemic. And
could we have done it without them, Mike?
They have been very supportive in our efforts. They have contributed immensely in the way that we have responded. And we value their input, we value their effort, we value everything that they've brought to the table. And MRCs are not just medically inclined. We have individuals who are non-medical as well, who are our MRCs. And not only do they provide these things that I mentioned, their expertise in the subject matter is also valued. I've had a number of conversations with Dr. Gann about the COVID situation, and he has provided some scientific vital information which we have implemented or incorporated in the way that we are responding to COVID-19. So they have just been tremendous and instrumental in our response. And I'm hoping that we can get more volunteers. There's still a lot of work to be done, and we're encouraging people to apply and join the MRC.
I have yet to have anyone send me an email or call me and complain about the process of getting vaccinated. I mean, they would complain and say, "Why haven't I been vaccinated?" and all of that. But once they were registered to be vaccinated, the experience that they had, Ike, with you and your staff and all the city staff, our facility staff, our firefighters, and with all the volunteers from CERT and from MERS, really has left a good taste in people's mouths here about seeing, how effective this community, and I really mean community, not just our government, but has worked in getting everyone vaccinated. So thank you to everyone for that. We're wrapping up now. I'm looking at the questions. We didn't get any questions online today, but I'm looking at the questions that came in from folks, and I think we've answered them. But real quick, Vina had asked about whether the city will have vaccination clinics in the evening and weekend hours to accommodate those who can't work during the day. We did mention earlier there's one coming up this Saturday, correct, Ike? Why don't you give us the details real quick?
Yeah, absolutely. We have one coming up this Saturday from 11 a.m. to 3 p.m. We are going to be working in collaboration with North Shore to host an event at ETHS come May 22nd. That should be at 8 a.m. through 1 p.m. And we have been discussing internally to have evening events for those who cannot make it during the day. We want to ensure that we are reaching everyone in the community to get vaccinated, and these are the efforts that we are.
And reaching people where they are. I mean, for the longest time, it's sort of been, well, we, assume you can come in the middle of the day, but many people work and everything else. So, and in this Saturday's event, Fleetwood Jourdain, right?
Yes.
Okay, so Fleetwood Jourdain, you said from 11 to 3 p.m., correct?
Yes, sir. Yes.
All right. So if you haven't been vaccinated, come to Fleetwood Jourdain. So that takes care of Vina's question. Holly asked, how critical is it that I receive my second dose 4 weeks after the first dose? What if all the appointments are filled up and I'm unable to get my second dose until 5 weeks after the first? Will it be less effective?
It'll still be effective. And as I indicated earlier during this broadcast, you can still get your vaccinations, your second dose, 6 weeks after the first dose. But it is strongly encouraged that you get it within 3 weeks for Pfizer, 4 weeks for Moderna, 28 days for Moderna, and that's what is strongly recommended.
And I know the city's done a good job within a couple days of hitting those marks. Raphael asked, is it possible that vaccinated individuals can still transmit the virus to others? I know this is something that scientists have been researching, Ike, I know he and other people have that question. So.
Yeah, that's a possibility that one can still transmit the virus even after being fully vaccinated. You also have to keep in mind that the vaccine is not 100%. The efficacy is not 100%. At best, it's about 90-95%, and that might be an opportunity for one to contract or transmit the virus. So there are some opportunities for one to transmit the virus, but what we have been preaching there is that the benefits of getting vaccinated definitely outweighs the risk. So we are strongly encouraging everyone who qualifies for a vaccine to get vaccinated.
Okay. Carol asked, and I had asked Dr. Hicks asked Dr. Hicks part of the question, which she answered, which is that Illinois does maintain records on everybody that's vaccinated. Is there anything that Carol or any of us need to do to be sure that our records are up to date?
So what we've been encouraging, for those who've gotten vaccinated, I'm sure May, you have your card. I've been encouraging people to save those cards, to even laminate them, so that you can use that, because I think they will get to a point where even with travel, they will want to know if you've been fully vaccinated, if you're traveling abroad, if you're traveling elsewhere. So that card is important for us to keep. And to the question about if they're keeping records, yes, IDVH is keeping records of people who've gotten vaccinated, and that's how we are able to receive information based on how many people who've been vaccinated in Illinois who didn't rely solely on our vaccination clinics to get vaccinated.
I know the healthcare system. I had a doctor's appointment, and the doctor knew everything. I didn't have my card with me, and the doctor's like, "Oh yeah, I see that you've gotten your 2 vaccinations and everything." So again, the system should do that. Maintain the card. Dr. Gann was just holding up his. He had it at the ready.
One thing, Mayor, these systems are protected as well. So I don't want people to think their information is being given to non-public health agencies. The information is kept in order for us to be able to track, monitor, and schedule doses. So I just want everyone to know that.
Thank you for emphasizing that. And lastly, we had a question from Kamlesh and Jerry. Lots of people have this question. Ike, is it safe to go to the gym after I've been fully vaccinated? Is there anything specific we should be doing to protect ourselves and others at the gym?
As long as we're following protocols at the gym, at this point, what's been allowed is 50% room capacity at the gym. Just making sure that workout equipment is about 6 feet apart, making sure that people are wearing their mask at all times. Making sure that those facilities are wiping down equipment with disinfectant. And my recommendation would be call in ahead of time if these facilities or comply with these recommendations. Ask questions, and if you don't feel comfortable or if they're not applying these protocols, if they're in Evanston, let us know. And even if they're not in Evanston, let us know. We have our ways of communicating to respective local health departments to follow up on these cases.
Great. Thank you, Ike. 2 final questions. It's the same question for 2 of our guests, for Dr. Hicks and Dr. Gann. We'll start with you, Dr. Hicks. You volunteered. You weren't paid. Everything else. Why did you do it? What was rewarding about this experience for you?
Well, I mean, I did it because this has been a huge public health emergency. I mean, and the city needed our help and asked for our help. So that's one reason to do it, is just try to do my part and help out here. It's been a really enjoyable experience for a lot of the reasons that Dr. Gann mentioned. It's really fun to talk to people at the clinics. It's been, as he said, the city staff is amazing and great. It's been really fun to work with them. As a scientist, I've really enjoyed watching how every pod, they've kind of improved things a little bit. So there'll be some kind of little new thing that they've added that just makes everything easier. Maybe things will move around, or maybe we have a new printer or a new computer. So it's been really fun watching that process just get really honed. So for me, that's, something that's really, really fun to watch. And just, getting this, momentous task of getting everyone vaccinated, making progress in that, for me, that's huge. That's the main reason I'm doing it. So.
Awesome. Well, thank you, Dr. Hicks. And Dr. Gann, same question for you.
Yeah, but she said it really well. I mean, it's exactly the same thing. It's both. It feels like a privilege as well as a responsibility to step up when we have the opportunity. And for some of us, like myself, I've been mainly working remotely for most of the last year. And so if it wasn't for that, I think it would have been virtually impossible for me to help out. But it otherwise would have been very hard to just sort of sit at home and see this public health emergency occur and not help. I mean, it's a fundamental sense of civic duty that leads people to do these things. That's all.
Here. I agree with both of you wholeheartedly. Yesterday, for the first time, I think possibly in the history of this city, I awarded that a mayor. It could have been any mayor, but I happened to award a key to the city to an actual department within the city, which is highly unusual. But the moment in time that we're living in right now is highly unusual, and so I was really, really proud to issue 5 keys to the city, and one of those keys to the Evanston Health and Human Services Department. And it will be displayed in their office, unless it's there at your home right now, Ike, and we can look at it right here. It's going to be displayed in the Health and Human Services Department, and it was the only thing I could think of that in a prominent way, offer a really, really big thank you to the incredible amount of work that our city staff, led by Ike Ogbo and Greg and Anas and others, have done. It's really been remarkable. And so I want everybody to know that. And I will, at this point, sign off. I don't know. I think if something heats up, there could be a future coronavirus Q&A. But this could also potentially be the last coronavirus Q&A. It certainly is the last one where I will be the mayor. It has been a fascinating experience and a privilege to be the mayor of one of the best urban ring cities in America. I'm super proud of what everybody in this city has done in a really difficult time. So thank you for that opportunity. Thank you to all of our guests today. And let's go on and continue to keep our city safe and equitable and prosperous as we come out of this tough time. Thank you, everyone. Bye-bye.